Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hello and welcome to episode 64 of the Counselling Tutor Podcast with me, Rory Lees-Oakes, and with me, fresh from the break, Mr. Ken Kelly. How are you, Ken?
Good, yes. We're on the other side, I guess, of what some call the silly season right now, and looking forward to 2018. There's just been so much talk on the television and kind of in the circles I'm in of planning and what are you going to do differently for 2017. So in true counselling tutor style, we're swerving that. We're going to get on with the stuff that actually matters, and we've got an episode that you are going to absolutely love. And we're going to start off by looking at the use of language, what kind of language we use within our sessions with clients, and what kind of language our clients may bring in, and how we can work with that, how we can understand and interpret that. I just recently on the television, Escape from the Jungle program, and one of the new words that I heard that was coming out was feral. Oh, that's feral, meaning that's bad, or that's not nice, or that's disgusting. And quite recently there was the saying, Rory, oh, that's sick, meaning not that it is ill or not well at all, but meaning that that is good, and we need to understand that. So looking at language in the therapy room, going on to no theory with Rory. Did you spot the difference? Because this is the new year, and of course we'd like to change things up a little bit, and we want to broaden what we bring you. So we have a brand new slot, and it is called Practice Matters. Rory, you're going to be bringing us something from practice today, Practice Matters, and what are you going to be talking about?
We're going to be talking about assessment and assessing clients for therapy. And one of the most important aspects, certainly if you're starting in practice, is to get into those really good habits and making your own little assessment before you start. Really, really good habit to get into, because eventually when you go into private practice or you work professionally, maybe paid work, you're going to have to do it. So you should start as early as possible.
Excellent. And then we're going to end off today's episode 64. We're going to be looking at interventions. And in particular, we're going to be focusing on person-centered interventions. And of course, it came up from a question that came from our Facebook group, and as did our opening topic. Now, if you're not a member of our Facebook group, you want to get in there. Close on 15,000 fellow like-minded students of counselling psychotherapy. We've got some tutors in there as well, some qualified counsellors who hang around because they enjoy the CPD, that continuing professional development. We talk about counselling, we talk about practice, and you can come and join in that just by going to Facebook and put in the word Counselling Tutor. We're right at the top. It is a closed group. You'll need to knock on the door to let us know that you are a student of counselling. We'll open that up and you can come and join in. And what message did we get this week that kind of prompted this topic, Rory?
Well, I'm always grateful for the ready supply of topics for the Counselling Tutor Podcast. Every week we just dive into the Facebook page and we see the questions you're asking. We're going to try and we pick a couple out and try and give you some answers or a view. And today's question comes from Richard Sanders. So, hi Richard, how are you? And the question is, if a client uses the term "that's gay" to describe something that's less than worthy, do you think that the therapist should speak about the comment with the client? Would it make any difference if the therapist was actually gay? ? Well, I think use of language is an interesting one, and I'm going to address the second question first. Would it make any difference if the therapist was gay? Well, it would depend, I guess, on the therapist. You know, I think that there may be some therapists who weren't gay who could be offended at that, and certainly in terms of the world we live in now, if you use that, certainly in the government departments, I dare say that someone may very well take you to one side and say, really, you know, you can't be saying that nowadays because you might offend somebody, and you know, you shouldn't be offending people. But do we challenge clients who say these things? It's an interesting one, isn't it? And do you know what my view is? My view is that sometimes when clients do that, they can either be testing you, or it might be a link to what's actually going on for them. So I don't think it's a therapist's job to be an agent of social control and police the clients. I think it's a therapist's job is to try and find out the meanings. And my view is that I would ask them and say, when you say that's gay, what does it mean? And you know, when I was a child therapist, they used that all the time. It was just a patois, you know, and there's no intent behind it. There's no homophobic intent. It was just a piece of language, and I understand that for some it's unacceptable, but sometimes I think reading the intent is just as important as understanding what's being said.
I like that, and we always come back to the same places, and the one that I find myself at right now is that self-concept. It's how we view, or how we, what weight or credence we give to a certain word that somebody may use. My daughter is 14. And she is at school, and they've got their own language. In the same way as when I was at school and I was in my teens, we had our own language, and it was our kind of a way of kind of having a chat within the school that the teachers didn't really understand because they weren't hip and they didn't know what we were really talking about. And that language kind of goes out of fashion and back into fashion as it goes. And my understanding of, that is so gay, does not necessarily relate to being gay. It is just a saying in the same way as that is sick does not mean that person is ill. It just means it's cool. I look back in time to where somebody might go, that's queer. That's a really queer thing. And you might hear from an elderly gentleman might say, that is queer. But when I was at school, queer was a derogatory word that was used to relate to somebody who was gay. And so the words change, and it's about, I like what you said, Rory, is check with the person what that means to them. Yeah, because if a person says, oh man, I've just got this new cat and it's so sick, we as a counsellor may go, oh, that's such a shame. And they're going, no, it's a sick cat. Wow, sick, really good. It's confusing. We need like a translator in the room. It
is tricky. And I think we shouldn't underestimate that words have tremendous power. And, it's easy to say, well, it's just a word. But, if you're on the receiving end of abuse and derogatory comments, it's just another drip of the weight that you have to carry. So, in no way do I think that I personally wouldn't use that word in my general language. I think it's about intent. I also think it's about really exploring where the client's coming from. And in my experience, I've worked with clients through the years who've had quite interesting vocabularies for people of colour, for women, for people who are gay. But actually, by exploring that, you can come to where they are in terms of their own process of development and their own acceptance of themselves. So I think that, yes, sometimes, words can be offensive to a therapist, but I would be thinking about, let's explore that. Let's see what the meaning is. Let's see if we can find that meaning. And I think that's really, really important. So I hope that's answered that question, Richard.
Yeah. It certainly jogged it for me. And if anything, it's created more debate in my mind, because I think you're right, Rory. It's about examining what the intent in it is and what the meaning behind those words are, because they may have a different meaning leaving the mouth of the person who's there saying it to what is entering our ears, and that blockage as it could I guess hamper our way of understanding what the client is meaning. So really exploring, when you say that, what is it that you actually mean? Use some different words so that I can understand that. I don't think there's any shame in that, in not fully understanding, in clarifying with them and getting what they actually mean out of that. And I think that's definitely something to think about. And no doubt there will be more words as fashion changes that will come up that we may not fully understand the meaning of, and words that mean what sound like they mean one thing but actually mean something else, depending on what your frame of reference is on that. I mean, there's an advert out at the moment, don't want to plug them, but the saying and the catchline is that, oh, you're so money supermarket, and that infers something. They've created that this wording infers something if you watch those adverts, and people are starting to pick up on that, and they're starting to go out and have some dinner and say, wow, that dinner was really money supermarket. It's becoming absorbed into vocabulary. It's really interesting, I think.
It is. And as I said again, just to reiterate, we shouldn't underestimate the power of words. Words can be cutting, hurtful. They could add to the burden that someone's already carrying if they're the subject of being abused or who they are is being subject of historic abuse. And a good example, I don't know if people watch the program, have I Got News for You? But it's a satirical news program. And Jo Brand, who's a former mental health worker, superwoman,
oh yes,
excellent comedian, and they were talking about the recent scandals of people in power abusing power, certainly with women. And she said, she mentioned something, and the male panelist said, that's kind of trivial, isn't it? And what she said was really, really accurate. She said, it might sound trivial to you, but if you're a woman and you just have to deal with this on a daily basis, it grinds you down.
Yeah.
And ergo, the word gay could be, is almost certainly in that same lexicon of language. But in terms of our clients, let's try and explore meanings.
Love it. Thank you very much for the question. I love those questions that kick off that debate. And moving on, we're going into our new section, and the new section is called Practice Matters, because practice matters. Rory came up with the byline for that. I really like it. Practice, of course, does matters. And what it does is it just gives us a wider scope. We can bring all elements of practice and talk about that, as opposed to just focusing on the theory. Because at the end of the day, why do we learn the theory? It is so that we can be in a room in practice with a client. So practice does indeed matter. And I guess it also opens up that we may from time to time choose to bring guests on who can share their ideas of what matters to them in practice. So without any further ado, let's go straight into our very first, the inaugural Practice Matters.
Practice Matters.
Assessments in personal-centred therapy. Why do we do it? And has assessment always been a part of person-centred therapy? Well, I can answer the second question first. Yes, assessment has always been part of person-centred therapy. I went to an assessment training course a few years ago, and I was surprised when the trainer said, assessment's always been part of person-centred therapy. And the reason that you don't hear much about it is they never talked about it or wrote it down. They didn't call it assessment. In other words, they weren't very honest about it. But thinking about it, if you see the kind of clients that Roger's worked with, it's quite clear that the people like Gloria Zamansky from the Three Approaches to Psychotherapy film, were handpicked for her to be an example of how to use therapeutic approaches. She was a person who'd already had experience of therapy, as had a lot of the other people that Roger's interviewed. But why do we do assessment now? Why is assessment important now for contemporary therapists? Well, I'm going to give you some overview of that. And what I would say is that if you're a student, you most probably are listening to this, is that the way assessment works is that you will have a qualified, experienced practitioner in your practice who will see clients initially, screen them, and then will allocate a client to a therapist based on the therapist's level of skill, knowledge and experience. So it would be unusual, although sometimes it does happen, for a therapist who's just started to get a client who's got really heavy issues, because clearly it wouldn't match the student counsellor's experience. It could be completely overwhelming, and it's not really in service of the client. The client deserves to have a therapist who is competent at working at the issues that they present with. So the first thing about assessments is determining the client's needs. What is it that they want to change or alter? What is it they want to bring? The second is to discuss the client's expectations. Now, there's something called magic wand syndrome, where clients come and expect to be cured sometimes in 3 or 4 sessions. And I've had supervisees who've said to me, my clients come in and said, oh, you're going to be able to fix me. Well, that puts terrible pressure on the therapist. But also, it's a poor expectation on behalf of the client, because what happens if they get to 6 sessions and the client still isn't, inverted commas, fixed? So part of assessment is working with the client to give them a realistic idea of what might be achieved. The other reason we assess is to see if there are any health and safety needs. One of the things that in the 1950s and 60s that therapists weren't attuned to the same extent we are today is diversity. So, for an example, does a client need an interpreter? Does a client need help and support if they're a wheelchair user or hearing impaired? What about a client who wants to see a specific gender of therapist? All these kind of things are now standard practice. In fact, they're enshrined in the Equalities Act in the UK, so that we have to make reasonable adjustments to help people who may be wheelchair users or hearing impaired. The other area is what type of counselling would be beneficial. Someone who's really, really good at assessing would understand the client's needs and signpost them to a therapist who may very well be able to help them. So if someone came and said they had a fear of spiders, arachnophobia, I believe it's called, then sending them to a person-centred therapist may not be the best referral pathway. Possibly sending them to someone who's a cognitive behavioural therapist or a behavioural therapist, someone who might have a plan of exposing a client to a spider very gradually, may be the best way forward. Does the client have a preferred working style? Some clients may be very kind of kinesthetic. They might like to use clays or figure work or use objects to explain how they are in the world. So I think good assessment is around understanding how a client's working style is. Also, is the client in a safe enough place for counselling? When I've done assessments in the past, I've had people turn up clearly in trauma, and although there's a waiting list for therapy, sometimes it's useful to try and find other areas of support for them before they go to counselling. If someone's just lost a loved one and then discovered as part of that they borrowed the entire equity of the house and that the person now is going to be made homeless as well, counselling might not be the best first step. It's very possible that they may need some more practical support. So sometimes good assessment is about looking at what the client's bringing and suggesting that there may be other things that they could have as well that may be able to support them. And that really comes up to, is there any other service needs to be recognised? One of the things about modern counselling is that most practices really have an obligation to be to have a holistic approach. So if a client turns up and wants counselling but wants help around alcohol, coming off alcohol or substance misuse, really they should be directing them to an agency that supports that. Yes, counselling as well, but also directing them to an agency that would support specifically the coming away from or stopping using alcohol or substances, drugs. And finally, are your experiences and modality a good fit for the client? Really, it comes back to what I said earlier about making sure that a therapist that's been allocated has a good understanding of what the client's presentation is. And there's a little word of warning here. One of the things that I've changed my mind on through the years is when you get the referral. In my very early days in practice, I have to say that I never read the referral, apart from any kind of health and safety issues or any risk issues. But the general referral that was by the referrer, I never used to read. But what I did towards the end of my time when I worked for an agency was always read the referral. And the reason for that, the reason I didn't read it, was because I wanted to hear the client without a filter. I thought that was a very principled, person-centred approach to take. Not hear someone else's words, but hear the client's. But through the years, I've realised that sometimes with very difficult presentations around abuse and neglect, clients might not want to talk about those triggering events again. So sometimes it's useful, if you have the referral, just to say, I've read the referral. And just kind of gently explore, is this what you're looking to work to? And you can get a lot of detail in the referral, which gives you a good overview for the client before you start working with them. I've had clients who have literally kind of sighed and said, oh, I don't have to explain it again, do I? And I can understand that. And certainly there's some evidence that with very traumatic events, retelling the story can re-traumatise. What other things are there to consider? Well, the first is reality. When you meet the client, do they have bizarre thoughts? Is their grasp of reality too fragile for counselling? So in most therapies, in particular person-centred therapy, we talk about the psychological contact. And I think that's an interesting one. You have to be pretty convinced that a client shares equal and present time. And if you get someone who's hallucinating or maybe in psychosis, then really they may need another form of support. Therapy may not be the most useful place. Countertransference. Sometimes we get really strong feelings about our clients, and that can come from our own history. Maybe you work with a client to remind you of someone, or they speak like someone. Many years ago, I had met someone who was terrified of their clients, even though the client had not given them any reason to be terrified of them. But every time the therapist sat down, terror was the word she used. And we went through a lot of transference. We tried to work out, did they look like someone, sound like someone from their past? No, absolutely not. And then I just kind of said, what does he smell like? And the supervisee sat up and said, that's it. He smells like the person who abused me. So there you have it. And in those cases, you have to take a real principled view whether the therapist can still work with this client, because there may be personal work for the therapist to do to try and get around it. And some, certainly with things like smells, can be really, really tricky, I have to say, because they really embed into the brain. It's the olfactory bulb and the limbic system of the brain. It can really trigger people. So sometimes you really have to take a view, and maybe a principled referral onwards could be useful. The other thing to consider with assessments is lifestyle. My good friend Bob Cook from the Manchester Institute for Psychotherapy says to his students, and I wholeheartedly agree with him, therapy is a process, not an event. So, if you start someone with therapy, there is an expectation that the change will be made not just in one session, but through a series of them. So if a client's got a very chaotic lifestyle, could be issues around childcare, debts, crisis, moving around, or may not be able to cope with regular appointments, you've really got to take a principled view, an ethical view, whether you can actually start counselling with someone. Because if you open them up and they open up and all of a sudden they can't come back, yes, it is their responsibility, but it could do more harm than good. And if a client says, well, I could come, I'm moving to another part of the country in 2 weeks, so I'd like 2 weeks worth of counselling, then I think you need to take a principled view and maybe say, well, 2 weeks may not be enough. There is a kind of principled and ethical view on that. The other thing I'm always curious about is why people have sought therapy now. What brings you here now? And one of the things that I've learned through the years is that certainly with people who've been abused, they usually present to therapy when their children are at the same age they were when they were abused. There's something about seeing ourselves in our children. And that can be really useful to know, but it can also be really useful for the client to understand because if it comes up, because the client can link the two things. Sometimes not coming to therapy or coming to therapy for no reason other than they feel they need to can feel a bit wrong for clients, but understanding why that is can make a lot more sense. And finally, what I call magic wands, clients who come and say, I've come to you because you can cure me and I want to be cured within 3 weeks. No pressure there then. It does happen. And again, a principled view and a conversation needs to take place to manage those expectations. So that's why we do assessments. So should students do assessments? Well, my view is I think students should. I think they can do a soft assessment when they first see the clients because things do change. there's a very good possibility that the clients you're seeing in practice may have been on the waiting list for a month or so, and within a month a lot can change. And also, it's good habits. One of the things I used to really be keen on when I taught my students was get into good habits early. Get your toolkits. I say to my supervisor, you get your ducks in a row. In other words, make sure your toolkits that you use for the practical stuff of client management are working and work for you. So having a good assessment protocol and just keeping those good habits of assessing can make your practice life a lot easier. Also makes you, I say, a little more ethical, because clients are going to get exactly what they want, and if it's not therapy they need, then that can be addressed sooner rather than later. And also, they're really good habits for when you eventually qualify and go into maybe private practice where you're going to be doing your own assessments.
Thank you very much for kicking us off there, Rory, starting that game as the whistle blew on Practice Matters, and a really interesting topic. When we speak about assessment and we speak about person-centered, I remember the debate when I was studying that, can we really assess someone if we are a person-centered counsellor? And I think that the way that you covered that was beautiful. And of course, Rory's handouts are always super helpful. And if you would like to get Rory's super handout from today's Practice Matters, you can do that. And how do you do that? You go to our website. That's where kind of the Counselling Tutor home is. And you'll find that at counsellingtutor.com. And right at the top is the little menu bar. And if you click on podcasts, all of the podcast lists down. And if you click on episode number 64, that's today's episode. All the show notes of today's episode are there. All the links of anything that we may have mentioned, everything précis down so that it's quick and easy to read over and reference when you're doing your assignments. And right in there is that link. And when you click that, you can download Rory's super duper handout from Practice Matters. And of course, if you are already a member of the Counselling Study resource, no need for you to go through that, because you can just log in to your Counselling Study resource, go to your handouts vault, and it is already in your handouts vault. We've uploaded that for you already. And if you're a handouts vault member, it's in there. Just go and get that. And if you're wondering what is Counselling Study Resource, what is the handouts vault, well, we'll give you more information on that at the end of today's episode. But moving on, it's another topic. It's person-centered interventions. And this has, of course, come up from a Facebook comment. Rory, can you share?
Yes, well, again, we're always grateful for that goldmine that is, in fact, the Facebook feed.
Oh, yes.
Our whole podcast is based on the comments, really. But yeah, so we're thankful to Trudy Ann, one of our contributors, who posted, "I'm struggling with person-centered interventions for one of my assignment questions. I don't think person-centered counselling involved interventions in the way other approaches do, but apparently they do, yet I can't find much intervention to support this. So far, I'm thinking necessary and sufficient conditions, use of self and immediacy. Any ideas, welcome. Thank you." So here are the ideas. Yeah. And I think one of the things that sometimes doesn't do students a great deal of service is to watch, I'm going to be controversial, Ken, is watching Carl Rogers practice with Gloria and all the other ones. Wonderful example of person-centered therapy as it was in the 60s, but not a great example of how it's developed and how modern practitioners use it. And one of the things, if you look at any of Carl Rogers' videos, he uses very few skills. It's all process.
Yeah.
And, nowadays, if you look at awarding body specifications, all of those say that you should use skills, which are any skills and intervention, because you're using it to intervene and to kind of develop both the relationship and the dialogue between your clients. So I would say that certainly in terms of the necessary and sufficient conditions, you're using empathy, congruence, unconditional positive regard. The other three are a bit difficult. Psychological contact, or presumably, if you built a relationship, that's there.
Yeah.
If the client's actually in the therapy room and having a session, and there's something to work with, then that's one of the other conditions that they don't often talk about, which is incongruence. And the third is if you've got a relationship, then at some point the clients recognise that your genuineness and your non-judgmental approach. But I think I think immediacy is a useful one that's really kind of sometimes undervalued, where the therapist shares a feeling saying, "This is the feeling I have."
Yeah.
I don't know if it's the feeling you have about this. This is what's coming up for me. Can be quite powerful and very collaborative. And also the use of questions, very skillful use of questions. And you'll know about this, Ken, because you really are the skills person. But use of questions, I think, is just one of the most important interventions, because you're gaining more understanding of the client's frame of reference. What do you say, Ken?
I say 100% yes. They're trickier when you say questions. There's always a word I want to add in before that, and it's use of appropriate questions, because questions can be so inappropriate and they can actually hinder the therapeutic relationship in closing down the client or taking them out of their frame of reference and then putting them in your frame of reference, because you maybe want to know something. Oh, have you tried this? Is definitely a question that is going to close down their thought process, because you're bringing yours well and truly into the mix there. But appropriate questions, where we are trying to better understand the client's frame of reference and how they see it and how they fully experience it, is a great intervention, because it basically invites the client to look and go deeper into what they're bringing, what they're discussing, and what they're processing right there in the therapy room. And another one, and I call it the lost skill, and it's the skill of reflection. Just a basic reflection where you're saying back to the client the very words that came out of their mouth. They may have said many words, but by listening carefully and truly being there with them, if we can take the gist of it, the essence of what they're saying in those few words, when they maybe touch on a feeling word, they might say, and this and this and this and this and this, but that really hurt me at the time, and this and this and this. And after that sentence, we reflect back and we say, it really hurt me at the time. And you're taking them back to the essence of that. That is an intervention. We're intervening. We're being there and actively involved and inviting them right back to where that emotion was, where we could see that pain kernel lies. So the skills definitely, and immediacy, of course. And again, immediacy, that's considered an advanced skill. And if you're looking for immediacy, just jump on the Counselling Tutor Podcast website, counsellingtutor.com. Go to the little search bar at the top, put in the word immediacy. We've got a great podcast on that that'll walk you through the use of immediacy, appropriate use of immediacy, but very powerful. But I'm also mindful that immediacy, when used, it has an element of a risk to it. And if it doesn't work, it can slightly fracture the relationship, but it will only be used when the relationship is formed to such an extent that it is easily repaired. But when it hits, oh my goodness, when immediacy hits and you bring how you are receiving and experiencing this client and that little nugget from you, and you put that out and the client goes, that's it, it's exactly like that, nobody's ever understood it like that before, you've hit the nail on the head. Wow. Relational depth, blub, 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 just takes the relationship to the next level, I guess.
Sorry, Ken, I just got distracted there. I could see you in a skin diver's outfit, with a snorkel and a mask and a wetsuit, relational. Yes, okay, move on, Rory. But yes, there you have it. And also, don't forget that skill, one of the most underrated skills, the use of silence, where you're just allowing the client.
Yeah.
Speak about everything, where they may have had advice or judgment or dismissal or being discounted. That is probably the most difficult skill to master, silence.
Yes.
Because you've got to stay silent. You're just there literally listening and holding that silence while the client explores that stuff. They can hear themselves talking about it, and there's nothing more powerful than your own words, listening to your own words. If someone's speaking their own words, they can sometimes, I've seen it's like magic. They talk about it. They say, well, as I'm saying that, I'm actually now kind of reflecting that skill of silence. So, what a fantastic episode, Ken.
It is. I've just got to jump on that skill of silence because I get terribly excited when when the word skill is in a sentence. And here's an interesting. I remember working with my level 2 learners, and skill of silence was the very first skill that we would teach. So this is beginners just doing those introductory steps into counselling. We'd do the skill of silence, and the exercise I gave them was to sit just together looking at one another for 30 seconds in total silence and not saying anything, and just to see how that felt. And it can be quite uncomfortable. I do understand that. But after the exercise, they were invited to talk about what silence meant to them, how they see that as an intervention. Because remember, it's an intervention. Doing and saying nothing is an intervention because you're not really doing nothing. You're 100% there with that person and you're seeing them and you're accepting them. And those core conditions are thick within the relationship. And with the level 2 learners, they ran out of something to say after about 10 minutes, because what can one say about silence? I ran the same exercise with my final year students who were out in practice, already practicing and just about to graduate, where we did a exercise on silence. And then I said, what does silence mean to you? And I had to stop them after an hour and say, you know what, we got other stuff to move on to. But boy, we talked for a full hour, Rory, on silence, on saying nothing. It is so powerful, so underrated. Want to learn more about silence? Get on the Counselling Tutor website and just put in the word silence. We've got loads of stuff on it there that you can go and look at. So well brought in there, Rory. Doing nothing is a great intervention because you're not really doing nothing. You are using a skill, the skill of silence.
Yeah, that's the thing.
Oh, I get too excited. I really do. So this is episode 64, Counselling Tutor Podcast. We started off by looking at the use of language in the therapy room, what that means to us, what that means to our clients. Practice Matters, brand new, shiny, brought to us today by Rory, looking at person-centered counselling and in particular assessment. And of course, ending today's episode looking at interventions. Are there any person-centered interventions? Oh yeah, you bet ya. We've told you plenty, so hopefully that will have answered that question. And what a great start to the new year, Rory.
Absolutely. So with the new year well and truly underway, as we always say, stay grounded and stay safe.
If you enjoy the topics and handouts here on the Counselling Tutor Podcast, then you will love the Counselling Study Resource. CSR was built by myself, Ken, and Rory Lees-Oakes to give you the support you need during your counselling studies. So get access to the world's most comprehensive collection of resources aimed at supporting you in your journey to become a counsellor. Take the stress out of your studies by visiting counsellingtutor.com/CSR. That's counsellingtutor.com/CSR.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.